Over the last few days, thanks to our world-class genomic capability in the UK, we have identified a new variant of coronavirus, which may be associated with the faster spread in the southeast of England. Initial analysis suggests that this variant is growing faster than the existing variants. We've currently identified over 1,000 cases with this variant, predominantly in the south of England, although cases have been identified in nearly 60 different local authority areas, and numbers are increasing rapidly. Similar variants have been identified in other countries over the last few months. We've notified the World Health Organization about this new variant, and Public Health England is working hard to continue its expert analysis at Porton Down. Mr. Speaker, I must stress at this point that there is currently nothing to suggest that this variant is more likely to cause serious disease, and the latest clinical advice is that it's highly unlikely that this mutation would fail to respond to a vaccine. But it shows we've got to be vigilant and follow the rules, and everyone needs to take personal responsibility not to spread this virus. Mr. Speaker, the first formal review of tiering decisions is taking place this Wednesday, 2 weeks after the new rules came into force. However, I need to tell the House that over the last week, we've seen very sharp exponential rises in the virus across London, Kent, parts of Essex and Hertfordshire. We do not know the extent to which this is because of the new variant, but no matter its cause, we have to take swift and decisive action, which unfortunately is absolutely essential to control this deadly disease while the vaccine is rolled out. In some parts of these areas, the doubling time is around every 7 days. This isn't just about rising rates among school-aged children anymore, but in all age groups, including the over 60s. And we know from painful experience that more cases lead to more hospitalisations and, sadly, the loss of more of our loved ones. Hospitals across the capital, Essex and Kent, are already under pressure, and we know that this doubling of cases will be mirrored in hospital admissions, and it only takes a few doublings for the NHS to be overwhelmed. Our NHS is straining every sinew to cope with the pressures, as they always do, but if cases continue to double, even they will be overwhelmed. So we must act now to shift the curve, because when the virus is growing exponentially, there is not a moment to spare.